Afternoon, everyone. This is Saro Arcadians, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Make sure to subscribe to the channel to receive daily notifications on medication news, updates, and education. An update on measles outbreak, which started in Texas. Measles outbreaks in West Texas and New Mexico are now up to more than 250 cases, and two unvaccinated people have died from measles related causes. Measles is caused by a highly contagious virus that's airborne and spreads easily when an infected person breathes, sneezes, or coughs. It is preventable through vaccines and has been considered eliminated from US since 2000. So the outbreak of happening it again, it's a kind of a big news and shocking. Texas state health officials said Tuesday there were about 25 new cases of measles since the end of the last week, bringing Texas total to 223 cases. If you remember in my previous video, I talked about 160 cases, which was last week. Now it's 223 cases. 29 people in Texas are hospitalized because of measles. New Mexico health officials announced three new cases Tuesday, bringing the state's total to 33. Oklahoma State also, the health department reported two probable cases of measles Tuesday, saying there is associated with the West Texas and New Mexico outbreaks. Measles cases have been reported in Alaska, California, Florida, Georgia, Kentucky, and Maryland, New Jersey, New York, Pennsylvania, and Rhode Island, as well as Vermont. The U.S. Center for Disease Center Control and Prevention defines an outbreak as three or more related cases, and there have been three clusters that qualified as outbreaks in 2025. In the US, cases and outbreaks are generally traced to someone who caught the disease abroad. It can then spread, especially in communities with low vaccination rates. The best way to avoid measles, just for your information, is to get vaccinated. Mm, get the measles, mumps, rubella vaccine, which is available in any local pharmacy that you may choose to go to. The first shot is recommended for children between 12 and 15 months old, and the second between 4 and 6 years old. People at high risk of infection who got the shots many years ago may want to consider getting a booster if they live in the areas of outbreak. So again, it's important to follow up with your provider, healthcare provider, to make sure they assess your risk factors. And for young kids, obviously, they should be vaccinated if you're an adult and it's been a while that you've been vaccinated. You should talk to your provider to get the booster shot to have the protection against measles, especially such an outbreak that has caused over 250 cases, as I mentioned, and two individuals have died already from the measles, and many patients being hospitalized in multiple states. So it's a growing outbreak. It's dangerous, especially for those older adults and with high risk factors, and it's something to be taken seriously. So, as the healthcare providers, make sure to speak with your patients about the measles disease um, signs and what to report. And if they see somebody with those signs and symptoms, to report. Also for the patients and to watch out for any symptoms as with related to measles, and report to their provider as soon as possible. Hope you enjoyed this video. For more detailed information on this outbreak, you can refer back to FDA website or the CDC website for news update. You can also comment on the video with your questions, and I'll be happy to answer any questions you may have on measles outbreak. Hope you enjoyed this video. As always, stay safe and take your medications.